Health for Life. This is the first ever medical show on television that deals with prevalent health problems and concerns, and they do so in an easy to listen to question and answer format. To find out what we're discussing today and to introduce us to the visiting specialists, here is the producer and the host of Health for Life, Dr. Surendra Prasad.
Good afternoon. I am Dr. Surendra Prasad, and welcome to another episode of Health for Life. Health for Life is a program designed to inform the public about common medical conditions. Today we will be discussing a disease that is very common in Guyana and actually very common worldwide. That disease is degenerative joint disease. My guest physician is Dr. Fawcett Jeffrey. Dr. Jeffrey is a well-known orthopedic surgeon who is in private practice and has privileges at some of the major private hospitals in Georgetown. He is also the primary force behind the Georgetown Public Hospital Corporation's orthopedic training program. Dr. Jeffrey, thanks for joining us and welcome to the program.
Thank you for having me. Hope that we can have a good program today.
So let's start off. What is degenerative joint disease?
The word degenerative means degeneration or destruction. So degenerative joint disease is just a process of degeneration or destruction of a joint. And the joints that are most frequently affected are the weight-bearing joints. So even though most of your joints can have degenerative joint disease, the ones that give us the largest problems is the hip, the knees, the ankle. Even though you can have problems with your fingers, with your elbows, your shoulders, but the hips and knees are usually the ones that give us the major problems.
Now, what about arthritis? That's the other common thing we hear about.
Well, degenerate joint disease and arthritis sometimes are used as synonyms. But we need to clarify, because arthritis really does not necessarily mean degenerate joint disease. Arthritis is an inflammatory process. Arthro meaning joint and itis meaning inflammation. So we're actually using the word arthritis incorrectly. We should really say arthrosis when we speak about degenerate joint disease. It's not. Arthritis is not a primary inflammatory process. It's a degenerative process. We do get inflammatory manifestations dependent on what is actually happening to the joint, and irritation from debris in the degeneration that making the joint become inflamed. But in reality, the process is not an inflammatory process. Now, arthritis is not one entity.
Okay.
Arthritis is a multiplicity, multiple entities that we have, and it depends on the etiology. So anything, any process that is causing an inflammatory manifestation in a joint is arthritic. However, you have the etiology could be septic, so you have septic arthritis, you can have psoriatic arthritis, you can have gouty arthritis, and I can continue going on. So rheumatoid arthritis, which is also very frequently spoken of, and that could be juvenile or adult rheumatoid arthritis. So we need to be very, very careful when we use the word arthritis. However, in the world over the years, arthritis has been used almost synonymous with degenerate joint disease, but it's really not so.
It's two separate entities.
Yeah.
Now, what are some of the causes of degenerative joint disease?
I usually use the example of your car and your tire. You drive the car, after about 3 years, you need to change the tire. But my car, that takes most times me alone in the car for most of the year, my tires will last 4 years. The taxi guy who drives 3, 4, 5, 6, 100 times in the day and takes load, his car will need changes of tires much earlier. So that's basically how I use my analogy for you to understand degenerate joint disease. So what causes degenerate joint disease? It's wear and tear of the joint due to stress, trauma, aging, or sometimes any other condition that could have affected the joint and caused damage to the cartilage that will make it degenerate. So I'm certain you're going to be asking the age groups, and in any age group you can have degenerative joint disease. It just depends on the etiology.
Now, how common a condition is degenerative joint disease?
In the present world, where we are living much older, degenerative joint disease is now probably the second most frequent cause of consultation in a doctor's office, because we are living much longer. So degeneration is happening. People are getting to ages of 80s and 90s now, so everybody gets degenerative joint disease. We actually say that degenerative joint disease starts in our third decade of life, which means in our 20s. And most people are surprised when I tell you in your 20s you start getting degenerative joint disease. Like, oh no, doc, but so young? Yes, you start degenerating in your 20s. But what happens, the manifestations only start showing in about your 40s. So that's why most people come to the doctor complaining of pains in the joints around their age 40. But it's not that it just started then. It's been going on at least a decade before.
Okay. So you've mentioned that the degeneration starts as early as in your 20s. With us, the population aging, and in their 80s, you're seeing a lot of this. But are there any age groups that are more prone to the development?
Yes. Usually we say your late 40s or 50s. That's the time when you see most people coming to you with severe degenerative joint disorder. So the age group is in your 50s.
Okay. Now you spoke about using the car and the tire as a parallel, which suggests that activity and load would play a role in this. So what are those particular jobs or activities that those persons are more likely to develop degenerative joint disease?
Well, remember, even though the exact reason and etiology for degenerative joint disease, except when we know it like trauma, there are genetic factors, like you just said, employment factors, sports. All of these things do create exposures to persons injuring their joints. We just simply say someone who stands for very long periods, especially if they're standing in bad position where they're putting abnormal stresses on corners or different parts of the joint, they are already exposing themselves to degenerative joint disease, and probably earlier than it would have appeared just because of their occupation. So yes, occupation, sporting activity, trauma or injuries, those are some of the most frequent causes of degenerative joint disease. However, genetics seems to be playing a very high role in the appearance of the joint disease without us being able to explain exactly how.
What are some of the symptoms that patients come to you with when?
The patient with degenerative joint disease, and I think we should probably kind of zoom in more on the hip and the knee, because those are the two areas where people will come most frequently for joint pains. So the symptoms are usually joint stiffness. Most times it is morning stiffness. They wake up in the morning and the joint is stiff, and they're having difficulty getting off the bed, but as they move around it seems to get better. So it's a dilemma, because the patient comes and I'm like, okay, I'm waking up stiff, doctor, but after that I seem to get better. And then it progresses from joint stiffness to pains. And then from the pains you could be associated with swelling of the joint. This is a time when it's the actual debris in the joint that starts to irritate the synovium that makes you get pain and swelling. So this is the period where the inflammatory process takes over. Initially it was just degenerative, but then as you start getting the swelling and pain, tells you that the inflammatory process, because of irritation in the joint, that's why the patients are getting it. So the patients have stiffness, pain, swelling, then they start with difficulty to use the joint better, so inability. Then it starts to impair their quality of life. And most times this is a time when the patient needs some intervention, when their quality of life has been hampered.
So it's a rather progressive
It's
condition.
a progressive condition.
And as you're saying, the pain is an indication that you've gone now into an inflammatory state.
Yeah.
They come in, and at somewhere along this spectrum, how are you going to make the diagnosis?
Clinically, you can make your diagnosis just like I said, and I keep saying. It's all about taking a good history, examining the patient, and you can make a diagnosis of degenerative joint disease. So the simple history of a patient telling you stiffness, difficulty to walk immediately in the morning, but then it gets better, that zooms you in immediately. This patient has degenerative joint disease. And to make the diagnosis, otherwise, you have other imaging studies and laboratory studies that can be used to assist you with your diagnosis.